Hello, everyone, and welcome to the complex composite masterclass. This is one of my favorite things to teach. I think it was one of the toughest things for me to learn as well. And once I mastered the technique, I feel like it's one of the easiest ones to do because once you've done it so many times, and that's what I ask everyone and tell everyone as well, that which is the thing that you find that's the most easiest for you, and they tell maybe to do a clean in clinical life, because I tell them you have done it 2,000 times. That's why clean is easy for you. One of my oral surgeon friends, his favorite procedure to do, and he thinks that the most easiest procedure to do is a sinus lift. And if I tell a normal person, they'd be like, oh my God, that's impossible. But for him, because he's done thousands of sinus lifts, that's the easiest procedure in the mouth. If I give him a complex composite, he'll be sweating. So nothing is difficult. It's all about how much you have practiced. Once you have practiced and practiced again and again and again, everything starts to become easy because you've done it so many times. Okay. So complex composite, what I generally like to do is I make a very big cavity. Ideally, it's not this big cavity, but I usually, again, as I tell you, on a practice basis, make sure practice with as big as possible. In my opinion, buccal cusp is the most difficult to do. Once you know this technique with the buccal cusp, you can easily do it in the palatal as well. It's not a big drama. It's a very easy thing to do. So as discussed previously, with my complex composite, the two things we want to do is we want to make the walls first. From complex, we want to make it to a class 1. Make it easy. Second thing, which is again the most important that we learned in the class 4 session as well, that until and unless it's 95% ready, I'm not going to cure it, because it's take us ages to then polish and finish and remove the excess. You should be done. So by the time you finish polish, it's hardly 5% or less to be done. And your life is a lot easier as well. Okay? So that's your complex composite. Will be to a buccal cusp. This is the tooth 2.5. All right, so let's go. First thing, matrix band selection. We will be putting a Toffelmeier in there. Now, a lot of people, if you don't know how to put a Toffelmeier, that's fine. I'll teach you all. This one that has a big of a loops to it, that gives us a bit extra height to it. So this one we will be using when we're doing amalgam fillings. Whenever we're doing amalgam restoration, we'll always remember, as a rule of thumb, we'll always use this sort of matrix band. Whenever we use composite, I will ideally do this, or if we require in a molar that we need to put the height, then we can either use this as well. But generally for a composite, I generally use this. Amalgams, I use this because height is a bit of an issue. If you don't know how to put a matrix band, there's nothing to stress. We all learn someday, that's okay. As a rule of thumb, again, what you need to understand is this U faces the gingiva. So if I'm facing like this and U is facing down, that means it's a lower tooth. If it's an upper tooth, then this will face like this, so facing towards the gums. Okay, because I'm doing an upper tooth, this should be facing here. Okay, now from there you can decide that is it gonna be on the palatal or buccal. Now when I get a buccal, I generally place it, and I'll show you. So if you see it like this, the bigger or the thicker one goes on top, and the one which is narrows it down, it goes in the gums. So that we have a bit of an idea, this section goes in the gums. Okay, so what I generally do, I learned this from YouTube actually. This is one clinician who is teaching this. I love this technique actually. You can never go wrong. Go straight go straight, and then from there you go in and see where you want to be. For example, if I want to place it like that, then what I'm generally doing is like that. If I feel it's other way around, because it's you right in the center there, like that, you can just turn it and do it. And that way you don't go wrong. You don't just keep changing the bend. Important technique, yeah. Bit handy. Now, always use a good one. Very important, you can't have any creases. Make sure nice and roundish. The roundish it is, no creasing or contours there. That means you get a nice contact, nice marginal ridge, nice contour of the tooth. Whenever you have any creasing going on, that's where the excess will flow. So making sure if you have accidentally bent it, just ask for a new one. But do not get an old one or something with a crease. You can correct it with a ball burnisher like I've done, but still just use another one. Okay. Now, when I am doing a buckle cusp, I have no problem placing the band palatally. I did that in my exam as well. There was no problems. Okay. I did that in the exam as well. I did the whole prep like this. There was no problems at all. However, if someone says, or if you get a very sort of like difficult examiner and they say, no, you can't go, then you can't keep fighting because they will fail you. Yeah. So in that way, this piece of sectional here saves your life. You get these in the exam as well. Okay. What we do is, and now let me show you again. I always say you need to learn everything, and then if you don't use it, that's great. But you need to know everything, because you never know that one day where the examiner having a bad day and trying to teach you some lesson, that day is your exam. So what we do basically, once you place it like that, where the buckle contour is, that's where the sectional will go. And then once you've placed it in the right angle, what you do is just run your probe, and this just flows out. And then tighten it up. Can you see what I've just done? Just in case you get an examiner who don't allow you to do it, just do it this way. Placing it on the buckle, use a sectional. I haven't done yet, like I'm not finished yet. Whenever you do any matrix band placement, with or without the band, make sure you contour it nicely. Remember, the sectional, the matrix band will decide your functional three, the first three: contact, excess, overhang. Exactly that. Sometimes if you try tighten up, it might come loose. Just loosen that up again. And then just take your probe again. Yep, and just run it. Run it. And then it will go in. And that should just flow in easily. So whenever the matrix band is not going in, just double check. See, there's a crease there. I want to show you all of that because just showing you a quick one, it's not going to help you. This is going to help you because this is happening. Ideally, just get a new one. Otherwise, just correct it with the ball burnisher. But yeah, just ideally get a new one, get going. Do not waste time in trying to fix the one that is not working here. So this goes in. Yep. Take the sectional. Sectional goes in there. Okay, that goes in. I have had people who the examiner didn't allow and they were stressing the entire exam. They just ruined the whole exam. So you might feel this is what normally just very quick when I apply it. But sometime, yeah, if it doesn't go, just take a bit longer. That's all good. But yeah, just make sure learn all these techniques. Yeah, they are very handy and they're very critical in your time when you are doing your exams and stuff. Because they do create a lot of big difference. So every time something getting stuck, check with your mirror. I can't check with the mirror right now because I am, that goes in like that. Beautiful. Go on. Make sure you can see what I've done. Nicely contoured, gone in. So good idea to learn this. You may not need it, but you should know how to do this. So just in case you get an examiner who's a bit like, oh, you can't do this, you do that, you should know how to fix it. Okay, place it on the buckle, sectional, top it up. Okay, for this sort of presentation today, I will be putting it back on the paleto. However, you can do the full composite without that as well. Okay, it does works very similarly. Shouldn't have any dramas there. But I put it on the palette. I did my whole exam. Didn't have any problems. However, you might have that examiner on your day. So we just don't want to risk that. Yeah. For anybody to having, we should know how to do it. Again, check. Go there. All the way. Generally, if the cavity preps in the exam, again, as I'm mentioning, they are nicely done. So you get a very, just the matrix band literally just flows in. Literally matrix band, you put it in, flows in like this. Okay. Now with the matrix band placement, very important to know, you tighten this. This is for the tightening the matrix band. This is for the whole assembly. You learn this while do that. Once I've tightened this up, and if I see any gaps here at the proximals, for now it's okay. But when I place my wedges, one here, again, put it in, and then with the back of the tweezer, go all the way. So if I have slight gaps before putting the wedge, it's okay. By the time you put the wedge, it should be nice and closed. After placing the wedge, if you still see some gaps, then something is wrong and you better fix it now, because if you still have a gap there, what happens? Excess will flow. It's gonna ruin the whole thing. So if you see right now, comparing to the adjacent tooth, 4 is generally higher, 5 is a slight less, and 0.36 is a bit higher about the upper as the curve is flows. So just as a guideline, 4 is high, 5 is low, and to make your life easy, just keep it similar to 6, but lower than 4. Now, if you see the matrix band here, we still have the height is pretty good. So I won't be having problem with the height. Most important are these things here. I don't have any gaps. Okay, nicely closed. So this matrix band placement is good. This is what you should be doing. I'm trying to show you at every different angle, so you have a bit of a clear idea. So matrix band goes in, wedge in. After that, we're not done yet. Even if the borders look great, you still want to burnish it. Burnish the walls. Burnish the walls. Burnish the walls. Very good. And once you're ready, now is the time you are ready for restoring it. Very important to understand, this step shouldn't be rushed, because if you don't do this right, all that contact's not going to be good. Contact, excess overhang will be a big problem. It will be there at the end of the finish of the restoration, and it's going to be a nightmare fixing it. So making sure do this right, and then 90% of the problems won't be there. Okay, so matrix band placement, hope it's easier and understood. Let's go to the next part and let me show you how to restore it. See you in the next chapter.